Good day, everyone. So we're done with the discussion of your blood flukes. So today we're going to focus on your hermaphroditic flukes. So here are your learning objectives again. Kindly pause the slide to read them so you will be guided when you study for this topic. So the first group of hermaphroditic flukes that we're going to discuss are your liver flukes, or the flukes that inhabit your liver. So the first group would be your fasciola. So the most common fasciola species that could infect humans are your fasciola hepatica and your fasciola gigantica. So like your all other trematodes, the shape is leaf-like. The size, Fasciola hepatica measures 3 centimeters by 1.2 centimeters, while your Fasciola gigantica is 75 millimeters to 15 millimeters. So if you could see, gigantica is clearly bigger than your hepatica kasi diba 30 cm is 30 mm by 12 mm no. So if you compare the sizes, gigantica is bigger than hepatica. That's why it's named as gigantica because it's very big. So the anterior end of your hepatica adult worm, it has a short cephalic cone and a more prominent shoulder compared to the long cephalic cone and less developed shoulders of your gigantica. So the cephalic cone of your Fasciola hepatica is shorter compared to the cephalic cone of your gigantica. But the shoulders of your hepatica is more prominent. So mas klaro ang iyang shoulders compared to the shoulders of your gigantica. So their suckers are equal in sizes. So the same sila sa everything except the anterior end, and of course their sizes. Also, the vitellaria of your species extend to the whole field of the hind body. So this is your vitellaria, no? So basically, kani sila, these are kanang accessory na genital organs. So basically, they help more sila tig provide og kung sa chicken egg pa, marag sila ang tig provide og yolk sac to the embryo, except this is for your trematodes. So your Fasciola species, their eggs are large, measuring 130 to 150 micra by 60 to 90 micra. The shape is ovoidal, so ovoid or medyo oblong. Color is brown and bile stained. Bile stained, it's because asa gani ni sila makitaan, they're found in your liver, diba, and your bile passages. So of course, maabsorb nila ang color of the bile mo ng bile stained sila, medyo yellowish or brownish, So tanan trematodes are, all hermaphroditic trematode eggs are operculated, Kinsa lang gani ang non-operculated, it's only your schistosoma. So the eggs are non-embryonated when laid, and embryonation happens in fresh water. So the appearance of your Fasciola ova is described as hen's egg appearance, or mura daw itlog sa manok ang itsura sa ova. But you have to take note that the eggs are indistinguishable. So the eggs of your Fasciola species are indistinguishable from other Fasciola species, your Fasciolopsis busci and your Echinostoma and your Gastrodiscoides species. So basically, ing ani ang appearance sa egg, ani nila tanan, So indistinguishable. So usually when reporting ing ani, you do not specify the species. You just specify the genus of the organism or of the egg. So first here we have our Fasciola hepatica. Its common name is your sheep liver fluke, your common liver fluke, and your temperate liver fluke. Ngano siya gitawag nga sheep liver fluke? It's because ang yahang primary na host jud kay ang sheep and not the man. Pero makakause gyapon siya og infection sa tao once ingested. Also known as your common liver fluke and temperate liver fluke. So when we say temperate, it prefers or mas common siya in colder climates, so countries na mas bugnaw. So your Fasciola hepatica is the most common liver fluke, and it is the first trematode that was discovered. So in sheep, the lifespan of the adult worm would reach 5 years, and it could reach 10 years in man. So geographic distribution, you have South America, Africa, Australia, and the Far East. So mas common siya no sa places na mas bugnaw compared to your Fasciola gigantica. So your Fasciola gigantica is also known as your tropical liver fluke because it's found in countries with warmer na temperature, no? And it is also known as your giant liver fluke. Gitawag siyang giant liver fluke because, of course, again, it's very big. That's why gitawag siya og gigantica. So common parasites of herbivores, no? Like your cattle and your camels. And it is more common in the Philippines. So si gigantica ang mas common compared to hepatica in the Philippines because again, si gigantica ang makitaan in your tropical climates. So it is seen in the tropics, in Africa, and in the Pacific Islands. So your Fasciola species, no, their habitat is your liver and your biliary duct. So remember, di ba, gitawag silang liver flukes, it's because they live in your liver. So the first intermediate host, no, remember for all your trematodes, the first intermediate host will always be a snail. And for your Fasciola specifically, it's the Limnaea na, excuse me, it's your Limnaea nga genus. So for your Fasciola hepatica, it prefers the amphibian snails, no? When we say amphibian snails, those snails na pwede on land, pwede on water. So the type of snails na mugawa sa water, mubalik sa water. For your Fasciola gigantica, the intermediate host are aquatic snails or snails that are only in water. So always lang sila sa water. So the infective stage for your first intermediate host is your Miracidium. Now compared to your Schistosoma species that only has one intermediate host, the rest of your trematodes have two intermediate hosts. So the second intermediate host for your Fasciola species are your water plants or your watercress. So basically, mga aquatic plants ninyo like kangkong. So during the life cycle, diba, the ova is released in the water, the Miracidium penetrates, no? The ova hatches, the Miracidium penetrates, no, the snail, your Limnaea, and then it undergoes your sporocyst, Euridiae, and then eventually it becomes a Cercariae. So the Cercariae, kani siya ang mo find sa inyong kangkong and then or sa inyong any water plants, and then it will encyst. So meaning mo pilit siya diri, no, mo encyst, mo form siya og cyst within the water plants. So how does it infect your primary host or your definitive host, no? So the definitive host would be infected if you eat this water plant. So pagkaon nimo, that is how you become infected. So the definitive host for your Fasciola species is your sheep and your man. So mode of transmission is this, no? Eating raw or undercooked water plants infected with Metacercariae. So the infective stage for the definitive host is your Metacercariae. So the life cycle of your Fasciola species is, it starts with the unembryonated eggs, either gikan sa iyahang primary host, no, your sheep and your cattle, or from humans. So the unembryonated egg is released, no, from the stool, and then once it reaches your fresh water, it becomes embryonated. So from embryonation, from the ova, the Miracidium or the Miracidia hatches, and the Miracidia will penetrate your first intermediate host, which is your snail, no? So remember, for your other trematodes aside from your Schistosoma, there is a Ridiae and Metacercariae stage. So after the Miracidium penetrates the snail, it becomes a sporocyst, and then it becomes a radiae, no? So, first and second generation radiae before it becomes a cercariae. So, the cercariae is the free-swimming form na. Remember, sa schistosoma, cercariae na ang infective stage for the definitive host. But for your other trematodes, no, for your hermaphroditic trematodes, the cercariae is the infective stage for your second intermediate host. For your fasciola, the second intermediate host are your aquatic plants, no, your watercress, your kangkong. So it then encysts, no. So mag-encyst siya into your water plants. So this then becomes, so the metacercariae is the infective stage for your definitive host. So if your animals like your cow, your sheep, or the humans eat the kangkong, no, encysted with the metacercariae, dira sila ma-infect with your fasciola. So existation, no, di ba nag-insist man siya, so it needs to exist. So the existation happens in the duodenum, no. So after existation, it penetrates the intestinal wall and migrate through. So from your duodenum, it penetrate niya ang intestine and it migrates to the liver, no. So, and then sa liver dira na ang makita ang adult worm. So from the liver, it further migrates pa jud to the biliary ducts, no. And then dira na magsugod ang life cycle. So from the biliary ducts, the ova would be released through your bile duct to the intestine and then passed in the stool. So that is the life cycle of your fasciola species. So pathogenesis of your fasciola, so they are larger, no. Remember, dagko kayo ang fasciola species. So the pathogenesis is more mechanical. Unsay pasabot sa mechanical damage, more on during their migration, during their movement, diba, they're really big. So every time they move, they damage the parenchyma or the functional cells, no, of your liver. So every time they move, mulihok sila, madamage ang cells, magaras ang cells. Every time they imagine they're very big, no. So every time they migrate, they move, they do anything, it damages the cells of your liver. So the humans are not the primary host. Remember, the primary host of your fasciola are your sheep. That is why it is more severe because the parasite was not designed for humans. It's very inflammatory to the humans. It's because it is very, kumbaga, it's very foreign for the human body ang fasciola. So during acute disease, when does this happen? This is during the migration, no, from your duodenum to your liver. So what happens is there is fever, right upper quadrant pain sa imuhang abdomen. So ang sakit is ang right upper quadrant of your abdomen, and of course there is eosinophilia. Again, what is eosinophilia? Na ay eosinophils, diba, in your blood. Ano gani kay eosinophil ang white blood cell na mo respond to your parasitic infections. And of course, there is hepatomegaly. So of course mo enlarge ang liver, no? So the reason for all of this is again, the metacercarial migration. So once it becomes chronic, once chronic na infection, there is already bile obstruction, obstructive jaundice, and dilation of your bile duct. So the reason is your adult worm. Diba, for example, dawatan na lang yun yung akong drawing. This is your liver, no? And then, this is your intestine. And then, this is your bile duct. So what happens is, why is there bile obstruction? Because if you will remember, diba, for example, this is your stomach. The life cycle from the metacercariae will migrate, from your stomach to the Di ba naman may space in between your organs? This is the peritoneal cavity. Peritoneal cavity. From the peritoneal cavity, it migrates to the liver, and then the adult worm would be found here sa inyong bile duct. Remember that your fasciola species are very big. So imagine if daghan na kaayo og if there are very many adult worms, it will completely block the bile duct. So meaning there is already bile obstruction. So instead that the bile would be released from your liver, diba? From your liver, passes through the bile duct and then released through the intestine. Dili na ma-release ang bile, it's because the bile duct has been obstructed by the adult worm. This also causes obstructive jaundice. So what is jaundice? So basically, for example, this is your red blood cells in the circulation. The lifespan of your red blood cells is only 120 days. So after 120 days, the red blood cell would die. And then, ma-release ang hemoglobin, diba, from your red cells. So, hemoglobin is converted into biliverdin. And then, from biliverdin, it will be converted into your unconjugated bilirubin. So, from your unconjugated bilirubin, it would be delivered to your liver by albumin. And then in the liver, mahimo siyang, once naabot na siya sa liver, it would be converted to conjugated bilirubin. Ang conjugated bilirubin, supposedly, i-release na siya sa imuhang bile, no? Musabay na siya. From your liver, the conjugated bilirubin would be released through your bile to the intestine, where it's gonna be converted to urobilinogen, bilinogen, and then finally stercobilin. So this gives the yellow color, no, to your stool. Maong medyo yellowish ang stool. It's because of stercobilin. But since obstructed, no, since there is obstruction in your bile duct, that means that the conjugated bilirubin cannot be released, no, into the intestine. So if dili siya ma-release into the intestine, there is no urobilinogen, and if there is no urobilinogen, there is no stercobilin. If there is no stercobilin, there is no yellow color. So what you will see, the stool of patients, no, with fascioliasis, chronic fascioliasis, or the stool of patients with bile duct obstruction, it is pale, no, or gray ang ilahang stool. That is your obstructive jaundice. Jaundice is the yellow discoloration, no, of the skin of your patient. Nga na may yellow discoloration, it's because the conjugated bilirubin, no, was not released into the intestine. Instead na reabsorb into your blood and then na deposit sa inyong skin. Kay supposedly, di ba, muagi siya through the bile duct, ma-release siya through the intestine. Since wala naman siya kaagihan because the bile duct was obstructed by your fasciola, na-reabsorb siya into the blood and then was deposited into the skin instead. And then of course, dilation of the bile duct. Sa sobrahan kadaghan sa adult worm, possible nga mo dilate or mo dako ang bile duct. Naasay, inflammation of the liver parenchyma, caused or known as your liver rot disease, no, caused by, or your liver rot disease are multiple subcapsular abscess. So what is that, no? So again, when we say abscess, no, it's like kanang mga nana god sa mad na nagnana. Like, that's when you hear the word abscess, that's what you think, no? Samad na nagnana. For example, this is your liver. Di ba naamay? Murag na ay coating ang inyuhang liver. It is known as your Gleason's capsule, no? Your Gleason's capsule. Now, during the migration of your metacercaria, for example, imagine na lang, they bore through the, no? Gisiun nila ang Gleason's capsule. And then, from the Gleason's capsule, they migrate to the liver. And then from the liver, they migrate pa jud further into the bile duct. Remember that your fasciola damage is caused by mechanical damage. So basically, their movement. So imagine that they bore through the Gleason's capsule, kumbaga murag ka ng coating, murag skin of your liver. And then they pass through the parenchyma. So the parenchyma is the functional part of the liver. So imagine na they pass through here from the Gleason's capsule to the parenchyma and eventually into the bile duct. Diba the bile duct is a lumen, so open space man na siya. So diri sila magstay sa inyong bile duct. But your liver, it's puno og hepatocytes, diba? The cells that are the functioning cells of your liver. So when they pass through that, agian nila na, of course, mamatay, maguba ang cells. So that is why naay abscess, no? Subcapsular abscess. Or mamatay ang liver moong naay rotting, no? Ang inyong liver. So of course, dead hepatocytes cannot function. So kana na parts of the liver, of course, non-functioning na or dili mamatay sa liver ang ilang mga giagian, no? But your fasciola is not associated with liver malignancy. So meaning your fasciola cannot cause liver cancer, no? Or walay association. There could also be spurious infection or pseudofasciolopsis. Pseudo meaning false, no? Or fake. So, dili tinuod nga naa kay fasciola. So, this is caused by the consumption of sheep liver with eggs. Remember, di ba, ang sheep ang primary host jud. So, if nikaon ka og sheep sa liver that has fasciola, unsa imong ma-ingest, di ba? So, if ang man ni-ingest og sheep liver infected with fasciola, imong ma-ingest is the adult worm. So remember, the adult worm is not infective for the man. Kaya diba, the infective stage is your metacercaria. So what happens is, since adult worm imuhang na-ingest, possible gyapon na within that liver sa sheep, no, for nag-imuhang gikaon kay naay eggs of your fasciola. So those eggs, of course, gikaon man nimo asa maadto ang liver na naga-contain sa adult worm and egg sa imong intestine. So inig defecate nimo naay makita nga fasciola nga egg sa imong stool, no? Na diba eggs are demonstrated in stool. So kani siya possible na ma-diagnose ka with fasciola even if wala jud kay fascioliasis, no? Mo nang gitawag siyang pseudofasciolopsis or spurious infection. So how do you remedy this? You reconduct a stool exam after 3 days of a liver-free diet. So 3 days na wala ka ni kaon og sheep liver. So unsa ang gina-expect na result after 3 days? Of course, wala na ova, no? Next, we also have halzone or your suffocation. So what happens is, for example, the same, no, you ingested infected nga liver, kanang sheep liver, ni kaon kag sheep liver na infected with fasciola. So what happens is possible that the adult worm is malodge sa imuhang pharynx, no? So instead na mauban siya, inigtulo nimo, instead na mauban siya padulong sa imong intestine, nabiling sa pharynx ang imuhang ang adult worm. So this causes a reaction, no? Specifically edematous. So what's edema, diba? Edema is your, kung sa Bisaya pa, hupong. Or kanang nihubag with water inside. So if your pharynx becomes edematous, no? Becomes inflamed with water, no? With water inside, of course, you cannot breathe, no? So naay suffocation. Suffocation. So, symptoms, dyspnea, acute dysphagia, of course, maglisod kag hinga, dili ka katulon, sometimes you become deaf, and of course, asphyxiation, no? Kanang, wala na jud ka hinga. So, dyspnea, dysphagia, deafness, and asphyxiation. So, how do you diagnose fasciola, no? Of course, the stool ay the ova are passed to your stool. Kaya diba, from the liver, it's released to the bile, to the stool. Or possible said that to use the aspirated bile. Diba? Kaya remember, they stay sa inyong bile duct. So, these are the, so, kani siya ang best, no? For the diagnosis, microscopy gyapon. So for acute infections, you could do concentration techniques, no? For unsa man na for your stool, unsa pwede gamiton, you have your ketocats, no? So egg stage, remember, indistinguishable ang eggs of your fasciola from your Fasciolopsis busci, your echinostoma, and gastrodiscoides. So serodiagnosis, no? So antibody detection has earlier detection than stool. So meaning mas paspas ma-detect ang antibodies compared to the ova, no? So your antibodies could be positive, no? As early as 2 weeks of infection. So unsa to na different test, you could use immunofluorescence, your ELISA, your immunoelectrophoresis, CFT, and Western blot to detect the antibodies. Pwede said molecular methods like your DNA probes and your PCR. And in your blood, you will see eosinophilia. So these are your eosinophils. Kaya sa gini sila increase during parasitic infection and increase during allergies, no? Your eosinophils. Increase sad ang imuhang IgE and IgG4. These are unsa ni sila antibodies. Pwede sad mo gamit og imaging techniques. What do you expect to find? Hepatomegaly, no? So when you do ultrasound, MRI, CT scan, or ERCP, unsa mo makita hepatomegaly or enlarged ang liver. So treatment is triclabendazole, no? So compared to the unsa schistosoma, unsa gani for all schistosoma they use praziquantel, but for your fasciola you use triclabendazole. Next is our Dicrocosilium dendriticum. Its common name is your lancet liver fluke or your lanceolate liver fluke. So it is a very common biliary parasite in sheep and herbivores. So humans are accidental hosts lang, no? Mas common jud siya. Ang commonly ma-infect ani is your parasite, and with this parasite is your sheep and other herbivores. So human infection are reported in Europe, Middle East, and in China. So, the adult worm, blunt anterior and posterior end, and then testes are anterior to the uterus and your ovary. If na-notice ninyo, nag-una ang iyahang testes compared to the ovary and to the uterus. Diba, normally, sa other worms, the testes is located somewhere here, no? Normally. But for your Dicrocosilium, the testes is located anterior, no? So meaning dapit sa ulo, no? Anteriorly. And then the uterus is branching, di ba? So makita ninyo na ay murag branches yahang uterus. So the egg stage is dark brown. Kani siya, no? The egg. 34 by 35, 34 to 35 by 20 to 30 micra, thick-shelled, embryonated, and operculated, no? Ang makita niyo siya by sa feces of your sheep and ingested by your land snails. So, mo ni ang difference ni Dicrocoelium compared to your other trematodes, di ba? All other trematodes, the first infective host are always aquatic snails, di ba? But for your Dicrocoelium, it's land snails. So, meaning snails na wala jud mo adto sa water, di ba? Ang others kay pwede amphibian snails, snails na naa sa land, naa sa water kanang, or aquatic snails jud na naa lang sa water. But for your Dicrocoelium, the first intermediate host are land snails. So always lang naa sa land, so never mo touch of fresh water. So the habitat of your Dicrocoelium dendriticum is your, of course, liver, because these are liver flukes, no? So the first intermediate host are land snails. Which specific species, no? Actually, there are more than 50 species of land snails. No, compared to your other trematodes na specific species only for the first intermediate host. For your Dicrocoelium, dili siya picky when it comes to the first intermediate host, basta land snail. So the compared sad to your others, no? Sa inyong others, diba usually for your trematodes, the ova is released sa mo hatch siya once it comes in contact with fresh water, diba? For your other trematodes, kung kaniyang ova, once na siya sa fresh water, dira siya mo hatch. Compared to your Dicrocoelium dendriticum, mo hatch lang ang yahang ova. The ova only hatches once na ingest na siya by the land snail. So the hatching happens inside the land snail. So diri nimo within the land snail, diri pa nimo makit-an ang miracidium, no? Once na ingest na sa snail ang ova. So once na ingest na sa snail ang ova, it undergoes from miracidium to sporocyst and then cercariae. So the same siya with your schistosoma, that there is no radiae na stage, no? So ang inyong Dicrocoelium dendriticum, no radiae stage. So the ova ingested by the snail, and then within the snail, miracidium, and then first and second generation sporocyst, and then finally ang cercariae. No, so no radiae stage also for your Dicrocoelium dendriticum. So once humana ang life cycle sa yun yung first intermediate host, the cercariae, di ba, remember, it's a land snail. So dili siya ka-swim freely into the water para mangita og second intermediate host. So what happens is your snail would release slime balls, no? Slime balls. So basically, mura niya siya kung sa tao pa, the cercariae man good is irritating for the snail, no? So basically, i-cough up nila ang once cercariae na, i-try nila cough up ang cercariae. Tas diri nimo na makit-an ang cercariae. If you put this in human terms, mura na siya plema sa tao. So basically, they release slime balls, no? They cough up slime balls. Tas this slime balls will be ingested by your kauno niya siya by your second na intermediate host, which is your Formica ants, no? So your Formica ants, for example, will eat this, no? Ang slime balls. And then your secondary intermediate host will ingest the cercariae within those within those slime balls, no? So the definitive host becomes infected when they accidentally eat the Formica ants, no? That is why humans are only more incidental host. Ma-infect lang ang humans if we accidentally eat the ants, no? For example, nagkauntog food, tapos wala ta ka-notice, alamigas na di ay. And if those ants get infected with the Cercaria, dira pa ta ma-infect. The same with your sheep and your other herbivores. So usually when they eat the grass, no, they unintentionally eat the ants, no, na naa sa grass. So mode of transmission is accidental ingestion of ants infected with the Metacercariae. So again, life cycle, humans are only incidental host, no? So, di ba the eggs are released sa feces, and then the first intermediate host, no, will ingest the egg, and then the Miracidia will hatch, no, inside the snail. Di ba usually the Miracidia ang mangita sa first intermediate host, but that is not the case sa inyong Dicrocoelium. So the Miracidia will hatch within the snail, and then after that, first and second generation sporocyst, and then Cercariae. The Cercariae will be coughed up by the snail ball. Tapos your ant, no, will eat the snail ball and then becomes infected with the Cercariae, no? So the Cercariae is the infective stage for your ant. So once the Cercariae has been ingested by the ant, it becomes a Metacercariae. And how does it affect, no, its primary host if there is accidental ingestion of the ant, if nakaon nimo ang ant, no? In the same life cycle with your other liver flukes, no, it penetrates from the stomach to your liver. So the same also with your fasciola, there could also be spurious infection, no? The same lang if you accidentally, or if you eat sheep liver with infected Dicrocoelium, you could pass the stool in your, you could pass the ova in your stool. But at the same time, dili ka ma-infect, di ba? Kay adult worm ang naa sa inyuhang liver and not the Metacercariae. Next is your Clonorchis and your Opistorchis. So kani sila similar life cycle, very similar sad na pathogenesis. Ang difference lang, no, how do you differentiate the adult worm is that using their testis. So your Clonorchis sinensis is branched, your Opistorchis is slightly lobulated, and your Opistorchis is deeply lobulated. So if you could see here, the testis of your Clonorchis sinensis branching. Opistorchis is slightly lobulated. Makita pa nimo ang branch, pero mura sad siya og circle, mura globule, compared to your Opistorchis viverini na deeply lobulated, no? Circle na lang jud imong makitaan, dili nakakasi og branching. So Clonorchis sinensis is larger than your Opistorchis, no? The egg, it measures 29 by 16 micra compared to the 19 by 10 micra of your Opistorchis. So it's oval and flask shape, no? Flask shape and mura daw siya og light bulb, no? It's like an old-fashioned light bulb, or mura po daw og picture. So dagan kay description of the ova of your Clonorchis or Opistorchis, no? This same with your others, no? It's yellowish brown and bile stained. Bile stained, of course, kay naa sila sa bile duct. So it is already embryonated when laid and operculated with distinct shoulders. If makita ninyo, distinct ang shoulders, and then naasay operculum sa egg, no? And then, kanyo siya, for your Clonorchis and Opistorchis, no, para dali siya ma-differentiate from the others, is naa siya abopercular knob. So, naa yung knob sa other end of your sa inyong operculum. So eggs of Clonorchis and Opistorchis are indistinguishable, no? So dili ma-distinguish ang eggs between your Clonorchis and your Opistorchis. So your Clonorchis sinensis, the common name niya is your Chinese liver fluke or your Oriental liver fluke. It is the most important liver fluke of man. So masking si Fasciola ang most common, ang pinaka-important is your Clonorchis. So it is regarded as a true liver fluke. So lifespan of 15 years. So possible na mabuhi ang parasite within your liver from 15 years after infection. So human infection of your Clonorchis is distributed or can be found in Japan, Korea, Taiwan, China, and Vietnam. Mong gitawag siya no nga Oriental liver fluke as it's found in the Orient. So life cycle habitat is your common bile duct or your biliary passage, no? Could also be in your gallbladder or possible sad na asa pancreatic duct. So the first intermediate host are your same lang freshwater snails, no? Of your kinsa Paraphosarulus na species padasad your Bulimos or padasad your Alosinma. No, so life cycle, the infective stage for your first intermediate host is the embryonated egg. So this same via ingestion, no? So not via the myricidium. So the same with your Dicrocoelium, ma-ingest sa first intermediate host ang ova before siya mahimong myricidia. So the infective stage for your second intermediate host is your freshwater fish, no? Like your carp, is your Lophocercus cercariae. Ngano siya gitawag nga Lophocercus? Diba? Compared to the cercariae of your Schistosoma nga bifurcated ang tail. For your other trematodes, isa lang ang tail. But specifically nga nung gitawag nga Lophocercus cercariae ang sa Clonorchis sinensis is because na siya murag fin. Kanang murag fin sa isda like this. No? So naay ing ana ang cercariae of your Clonorchis sinensis. So the definitive host is man. And reservoir is by the dogs or other mammals na mueat og fish. So the mode of transmission is ingestion of raw or undercooked freshwater fish infected with the metacercariae. So tanawa ang mode of transmission, ingestion of raw and undercooked fish. And tanawa ang distribution niya in this countries. Diba unsa ni na countries, mga hilig mo kaon og hilaw na isda, no? Like your sushi, your sashimi, mga ing-ana. That is why mas common ang Clonorchis sinensis sa countries na hilig mo eat or hilig og kinilaw, no? Kung sa Philippines pa kanang kinilaw na isda. So the life cycle, no? So the embryonated eggs is passed in the feces. So dili muhatch ang egg in the fresh water, muhatch siya once ma-ingest na siya by your first intermediate host. So within the first intermediate host, mahimo siyang myricidia, and then sporocyst, first and second generation radiae, and finally cercariae. So kanitong murag, kita ninyo, diba like, kani ang cercariae, mo normal na cercariae. But for your Clonorchis sinensis na siya ani kaning murag fin. So mo nang gitawag siyang Lophocercus nga cercariae. And then what will be released, no, is the cercariae. So the cercariae will insist, no, inside the scales or in the flesh sa karne sa isda. And then mahimo siyang metacercariae. And then ma-infect ang tao if ma-ingest na to tong metacercariae within the fish, no, na wala gi luto. So no, the same with your other trematodes, excitation in the duodenum and then migration towards your liver up until maabot siya sa biliary duct. And then the same, since na siya sa bile duct, yung excretion is via the stool. So Normally, if light ang worm burden, meaning gamay ra ang adult worms na nasa imong liver, usually if asymptomatic lang ka, so wala kay ma-feel, dili ka kahibaw nga naa na dae kay clonorchiasis. But if kanang chronic na infection, dugay na, daghan na ang adult worm, heavy ang worm burden, imong ma-feel you. There is fever, epigastric pain, sakit imuhang tiyan, there is diarrhea, hepatomegaly, mo enlarge ang imong liver. Of course, kay sa liver man naa ang adult worm, biliary colic, no, because they are in your bile duct. The same with your fasciola, there will be jaundice, kay na ay blockage of your bile duct, so your bilirubin cannot be released into your intestine, and of course, progressive liver enlargement. So, magkadako pa jud ang imuhang liver. So, no, during the chronic stages, no, if acute pa lang, if light ang worm burden, wala kay ma-feel. But if dugay-dugay na ang infection, daghan na ang worm burden, there is cholangitis, no, ma-inflame ang imuhang bile duct, no, ma-irritate, ma-inflame ang bile duct. There is dilation of the bile duct. The same with your fasciola. If daghan na kaayo ang adult worm sa bile duct, of course, mo dilate ang bile duct, no, murag ma-stretch kay napuno na siya og adult worm. And there is bile retention. So meaning, instead na from the liver ma-release ang bile into the intestine, mapundo hinuon ang bile within your liver and within your gallbladder. So the reason is mechanical obstruction of the adult worm. So meaning nagbara ang adult worm within the bile duct, no, mao na ang reason na naay cholangitis nga, no, inflame ang imong bile duct, mao nang ni dilate ang bile duct, ni dako kay napuno na siya og adult worm, and mao nang naay bile retention. So na-retain lang ang bile, dili siya ma-release into the intestine kay naay blockage. So the reason why pinaka-important si Clonorchis is because of this, no, desquamation, ductal epithelial hyperplasia, periductal inflammation, and fibrosis. So what does this mean? So every time, di ba, for example, kani ang epithelium of your bile duct, kani ang epithelial cells, no? Di ba? This is the lumen, this is the murag agihanan, murag the canal of your bile duct. Every time mo migrate, mo move ang parasite, there is desquamation. So meaning, mamatay ang epithelial cell, no? And then, what happens, diba? In response to injury, if naay namatay na cell, mo produce og bag-o nga cells. That is your hyperplasia. When you say hyper, meaning, OA rasad na response, no? Grabe, no? Hyper, over the top. So, if normally, ing ana lang siya, after sige siya kasamad, after constant desquamation because of the adult worm, what happens is your skin, no, your epithelium will try to protect itself. So para dili siya constantly ma-desquamate, mo produce siya og daghan kaayo nga epithelium. That is your hyperplasia or oversynthesis, no? Nasobrahan siya og synthesize in response to the injury. What happens then? So of course, if there is hyperplasia, no, so the more siya ga-produce og epithelium, the more sad magkabaga ang epithelium. Then what happens? So magkanipis ang lumen, no? So magkagamay ang agihanan of your bile. Then aside pa from that, occupied pa jud siya by the adult worm, no? So that is your hyperplasia and how it contributes to bile duct obstruction. And of course, there is inflammation, no? So daghan na ganig cells ni hubag pa jud ana. So asa na lang jud mo agi ang inyuhang bile, no? Ni hubag, ni daghan ang cells, no? So, ni inflame, ni gamay ang lumen, obstructed pa by your adult worm. So dili na jud kaagi ang bile. And then of course there is fibrosis, no? What is fibrosis? That is the deposition of your fibrous or connective tissue, no? So the same with your normal na skin, kana visible to you. If masamad ka, mahimo siyang scar tissue. Diba? Scar tissue is usually harder, no? Mas gahi, not elastic. And then of course, kung na siya function, non-functional na ang scar tissue. So that's what happens during your clonorchiasis. So all in all, no, it kuan eventually that constant hyperplasia kanang sige niya produce og additional na cells to compensate sa damage caused by Clonorchis. Eventually mahimo siyang adenomatous. So diba instead na normal na squamous cells, eventually abnormal na ang squamous cells na yang ma-produce. No, specifically in your adenomatous na hyperplasia, eventually mo develop og villi ang kung ano, cells na yang ma-produce. And of course, that's not normal for the cells found in your bile duct mo. Nang eventually, that constant hyperplasia, that constant production of cells will eventually lead to your bile duct carcinoma or your cholangiocarcinoma. So, di ba? The chronic irritation or the damage no caused by the adult worm in your bile duct will eventually lead to cancer. So, mo nang siya ang mas important. Kaya remember, si fasciola, even though almost the same sila ni fasciola o manifestations when it comes to signs and symptoms, fasciola cannot cause cancer compared to your clonorchiasis, which is related or associated to your cholangiocarcinoma. So, risk factor, the older you become, the more you become at risk, no? So, for cancer, and if there is already sclerosing of your bile duct. So, unsa pasabot ani, if your bile duct is already scarred, so dili na normal ang epithelium, like scar tissue na ang lining of your bile duct, dako kayo ang chance that it will progress into cholangiocarcinoma. So during the chronic stages, possible na there are calculi formation on sa many, that is your bile stones, no? Kaya remember, walay kaagihan ang bile. So mapundo lang siya. So eventually, mugahi to siya and becomes bile stones. Possible said there is biliary cirrhosis. On sa many cirrhosis, when you hear the word cirrhosis, this is scarring, no? So there is scarring in your bile duct, and then there is portal hypertension. Of course, kay ni block naman ang adult worm, so wala say ni block ni inflame, so wala kaagihan ang blood flow sad in your portal vein sa inyong liver. And naasay pancreatitis. Remember that clonorchis kay possible sad na maabot siya sa pancreas, no? Aside from your liver and your bile duct. So possible nga mo inflame sad ang inyong pancreas if it reaches your pancreas. So the laboratory diagnosis of your clonorchis sinensis is of course stool exam, kay liver fluke man siya. So from the liver, it's released to the ovas are released to the bile duct to the intestine. So morphologically similar to your Opisthorchis, your Heterophis, and your Metagonymous species. Possible sad na mo use og duodenal aspirate, and mas taas ang chance na makakita ka og ova using the duodenal aspirate compared to your stool. So serodiagnosis, the same with your other trematodes, no? You could detect antibodies using different techniques, no? Your complement fixation, hemagglutination, and your ELISA. Pwede sad antigen diretso, no? To detect the circulating antigens. Pwede sad PCR. PCR can be used both for clonorchis and Opisthorchis. Treatment of choice, it's praziquantel again. So praziquantel na sad. Your Opisthorchis viverini is also known as your Southeast Asian liver fluke. Pero it has a very high prevalence. So meaning grabe ka common si Opisthorchis viverini. So lifespan, the adult worm could stay in your liver for up to 20 years. Si Opisthorchis viverini is mas common sa Southeast Asia compared to your clonorchis, no? So Laos, Thailand, and Cambodia. So the same life cycle with your with your clonorchis lang. So Opisthorchis and clonorchis, the same life cycle, okay? So the same sad with your Clonorchis, if the worm burden is low or gamay lang ang adult worms na naani mo, it's a symptomatic. So pathogenicity is related to the multiplication of adult worms in the hepatobiliary system. So mas daghan ang adult worms, mas grabe ang signs and symptoms. The same with your Clonorchis. And then the same sad via mechanical obstruction. So nakaharang sila sa imuhang bile duct, mo nang mo inflame ang imuhang bile duct. So basically the same rejud with your Clonorchis. And then it is also the same with your Clonorchis related, no? It is also associated with the cancer of your bile duct, no? So dagag factors, no? It's because of the obstruction and irritation, epithelial dysplasia, di ba? Eventually mo himong naay villi na mo grow because of the constant hyperplasia, toxic radicals, no? So mga things that would kill your cell na released by your organism. It also suppresses the tumor suppressor, mawala imong tumor suppressor genes after a while. Di ba supposedly kaniyang mo stop sa imong cells from becoming a tumor. But the constant multiplication causes the loss of your tumor suppressor gene, activation of oncogenes, and then, no, so all in all, kana sila ang factors that could lead to cholangiocarcinoma. So other biliary manifestations, aside from the cancer of your bile duct, your Opisthorchis is also associated with liver cancer or your hepatocellular carcinoma. So aside from the bile duct, your Opisthorchis is also associated with liver cancer, and there is also hepatomegaly, cholecystitis, cholangitis, obstructive jaundice, no, and it makes you prone to bacterial infection, no? So inflamed bile duct, dili ma-release ang bilirubin into the intestine. So nasa inflammation of the gallbladder and blockage of the cystic duct, no? And then of course, inflamed ang imuhang liver. So the same with your Clonorchis, no? Stool exam gyapon, detection of flask-shaped eggs. Remember, dili sila ma-distinguish. So pwede sad na you will use permanganate stain to demonstrate the melon ridges of your Opisthorchis egg. You could use antigen detection for laboratory diagnosis. For your molecular, they use DNA hybridization instead of PCR cholangiography. What you see is your arrowhead sign and saccular dilation. So what will you see, no, sa imuhang ultrasound is kani daw you have arrowhead sign, and then of course na ay dilation of the bile duct, no? So treatment of choice, the same with your most, no, of your dermatologists, praziquantel ang drug of choice. Next, we have your Opisthorchis felineus, no? Feline, felineus. So meaning, asa siya makita normally sa imuhang cats, no? So its common name is your cat liver fluke or your Siberia liver fluke. It is similar to your Opisthorchis viverrini in morphology. So infection is limited to Central and Eastern Europe like Russia and Kazakhstan. So life cycle similar to your Opisthorchis and to your Clonorchis, except the definitive host are your cats and other felines. So the same clinical presentation, the same diagnosis, the same treatment. So basically the same everything with your Opisthorchis viverrini. Ang difference lang jud is naa siya sa inyuhang cats. So that's it for your for your liver flukes, no?